Hello and welcome to Time of Death. I'm your host, Dee.
And I'm your other host, Ris. If you're new here, welcome. We're two nurses that love talking true crime. We like to focus on cases that have a heavy medical influence to them, or cases that feature a medical professional as a perpetrator or victim. And we were not here last week, but we are back. Don't worry.
Yep, we're back at it.
Don't worry too much about us.
We went to a Twilight party.
Oh, yes, we did go to a Twilight party.
And we dressed up.
As Charlie Swan.
Plural. Charlie and Charles.
Charlie and Charles. Charlie and Chuck Swan.
We went.
That's Bella's dad.
Yeah, we were mortals. We were mere mortals. Mortals. Yeah. We also went into Whole Foods, and we want to give a special birthday shout out, belatedly, to Danton and Raimi. We heart you, girls.
And we have a special guest today.
Yes.
Purr for the microphone, Bubba. Thank you for the purr.
Thank you for the purrs. Important purrs. Hello, this is a disclaimer that this is an ongoing case and that any conclusions that have been made during this podcast are based off of the information that is currently available to us at the time of writing. Thank you very much. These are our thoughts and our opinions. Please don't sue us.
No, we can't add that.
Why?
Please don't sue us using the idea to sue us.
I hate you. All right. So just a trigger warning, today's case is... it does have to do with the death of a minor. So just a trigger warning for everyone. If this is not something you are in the headspace for, we'll see you next week. So getting into it, this case again is a very tragic one involving a controversial medical treatment, a devastating fire, and 3 people who are now facing murder charges. It's the case of Thomas Cooper, the 5-year-old boy who died recently in a hyperbaric oxygen chamber. So we've covered a lot of cases where medical malpractice, again, leads to these really awful, tragic outcomes. But this case is very different in that prosecutors are not just calling this negligence, what happened to Thomas. They're going as far as to call it murder. So really begs the question, was this a horrific accident? Or was the Oxford Center knowingly putting kids at risk for profit? So buckle up. Today is going to be a tough one as we dive in again to the dark side of alternative medicine. So on January 23rd, 2025, the Oxford Center in Troy, Michigan, it was just a seemingly innocuous day where Thomas entered a hyperbaric oxygen chamber for what was supposed to be a very routine session. He was being treated for sleep apnea and ADHD. You know, sleep apnea can affect kids for, a lot of reasons. They have large tonsils, adenoids, if there's some obesity at play, even nasal congestion or like some kind of abnormality of the cranium or the face.
Or tonsillitis. Or swelling of the tonsils, because, let me just get into this. I kept getting strep. Like, I got strep all the time when I was little, and then I started getting a resurgence of strep in my 20s. And I found out a lot of people have this, like, when they had it a lot when they were kids, they get it when they're in their 20s. And I was a new nurse. I was, like, exposed to all these germs. And I kept getting strep over and over and over, and my tonsils would get huge because I had tonsillitis with the strep. And I ultimately needed to get my tonsils out, but I used to snore so loud.
Yeah, she did.
You remember?
Yeah.
Because
like a freight train.
Yeah, because my tonsils were humongous.
You weren't a kid though. You were in your 20s. But no, great application to the real world, Ris. I appreciate that. But the most important part of this puzzle, besides Ris's tonsils, or lack thereof, is that...
They're gone now.
is that hyperbaric oxygen chamber therapy is not FDA approved for sleep apnea or ADHD. So the FDA approval means that the Food and Drug Administration, or FDA, has rigorously tested and proved that these treatments are safe and effective for specific conditions. So in doing this, the FDA reviews extensive clinical trial data before they grant approval, which ensures that treatment meets established safety protocols and standards. So this distinction is so important because using treatments outside of their approved indications expose patients to unnecessary risk without proven benefit. So in medicine, risk versus benefit conversations they happen on the daily. Anytime you initiate any type of therapy, whether it's a medication, treatment, whatever, you're weighing the benefits versus the risk. On this fateful day, the chamber was sealed and the staff began Thomas's session. Suddenly, something went really wrong and a fire ignited inside the chamber, which is tragic. Thomas was trapped inside where he suffered severe burns and smoke inhalation, and by the time first responders arrived, it was too late, and Thomas was pronounced dead on the scene. So that alone is horrifying, but what really turned this case into a criminal investigation was what authorities found while they were investigating the facility. So, but before we get into all that, let's take a step back and talk about hyperbaric oxygen therapy, or called HBOT. HBOT. Anyways, it was originally developed for deep sea divers who were suffering from decompression sickness, or the bends. But over the years, again, it's been peddled as like treats a whole range of conditions from autism to cerebral palsy to migraines, PTSD, ADHD, sleep apnea, the list goes on and on and on. Again, none of these are FDA approved. And it's essential that the oxygen chamber is sealed appropriately, as in this completely sealed chamber, the person in it is breathing pure oxygen, which means essentially that the oxygen is at higher than normal atmospheric pressure. And by doing this, the therapy is used to treat, again, a variety of medical conditions by increasing the amount of oxygen in the blood and tissues as the person is inhaling and breathing this in. So when you're breathing in pure oxygen at high pressure, your blood carries way more oxygen to the tissues, even those tissues that have been damaged or have less circulation. So essentially, this enhanced oxygen supply speeds up healing, helps fight infection, and improve tissue function overall. So HBOT is commonly and FDA approved to treat conditions like chronic non-healing wounds, carbon monoxide poisoning, and again, decompression sickness, or the bends, as the divers call it. It's also used in cases of radiation injuries, burns, and other infections like gas gangrene. Increased oxygen levels can stimulate the production of growth factors, promote the growth of new blood cells, so essentially it's helping repair tissues damaged by any type of injury, whether it be infection, disease, etc. But here's the problem. While HBOT therapy, again, FDA approved for specific conditions like carbon monoxide, poisoning, wound healing, it is, again, not approved for things like ADHD, autism, or again, sleep apnea. And yet, many of these like alternative health practitioners or clinics offer the HBOT therapy for these conditions and charge thousands of dollars per session. And that's where the Oxford Center comes in. The facility advertised HBOT as a natural and safe.
Wait, what kind of facility are they?
It's a health clinic.
Like a holistic?
Like an alternative medicine health clinic. So again, they advertise these treatments as safe and natural. I think it's important to keep in mind that parents who are desperate, who are willing to do whatever for their child, they, in the effort to help their son trusted the facility and its staff members. But as we know now very clearly, that trust was very much misplaced. After Thomas's death, investigators quickly uncovered serious safety violations at the Oxford Center. Prosecutors went on to say that staff ignored critical safety protocols and that this chamber itself was not maintained properly. The Attorney General of Michigan, Dana Nessel, made a statement and did not hold back whatsoever. She called the facility reckless and accused them of prioritizing profits over patient safety, which is a recurring freaking theme. And quality assurance is huge, right? Like, you have to do these tests. You have to make sure that, the defib. Well, I'm not.
The VFib, defib.
So I'm in psych. That these things are working.
Whenever I'm...
The soul. Remember that.
Good job. Whenever I'm working, quality is assured.
I just threw up. What do you have to say, though? I want to hear it because you want to say something.
That's what I had to say, but you didn't respond the way I thought you would.
I vomited.
Okay, continue.
So, by accusing them of prioritizing profits over patient safety, again, reoccurring theme throughout this whole freaking podcast, that's really why 3 people, 2 of which are high-ranking staff members, and 1 technician, are now facing second-degree murder charges, which is unprecedented. It is super duper rare to see actual murder charges in cases of medical negligence. Usually these kinds of incidents result in malpractice lawsuits, not actual criminal trials. But prosecutors argue that this was not a mistake. It was just blatant disregard for safety.
I'm anxious to see what comes to light during the trial, because that's what kind of things were they not holding up to standard? That's what I want to know.
That's what I want to know too. Because we'll get more into it, but the distinction is murder is the intent to do harm to someone.
Do you know what the prices were for these things?
I don't know. I can look it up though. On Groupon, you can get one for $44.25.
Good deal.
I'm trying to look because I've seen hyperbaric chambers. So one that probably looks the most clinical from what I can see is around like $22,000. I see it as high as like 45 though, or 80. So it's a wide range. But the fact of the matter is, some serious money, and they did not care to maintain them. As I digress, according to the state's case, employees had raised concerns about the chamber time and time again. However, management just blatantly disregarded them. But get this. There was allegedly, a previous fire in another chamber just months before Thomas died.
Suspicious.
A fire inside a hyperbaric oxygen therapy chamber can be caused by a lot of different factors, many of which are linked to the highly flammable nature of pure oxygen that is contained within the chamber. But faulty wiring, flammable materials like lotions, hairspray, and proper maintenance, these can all also be potentially causes. If this is true, if there really was a fire just months before, it means that the staff in the facility knew that these chambers were dangerous, but just continued to use them anyways. And let's not forget, and I've beaten a dead horse when I say this, but Thomas was not being treated for something H-bot is proven to help. He was being exposed to significant risk for a therapy that was not even scientifically supported for, which is heartbreaking. So what's the other side of this, Ris?
I don't know. You tell me.
The defense argues that this was a tragic accident, not a crime. They claim that they followed safety protocols and that the fire was just simply unpredictable. They're also saying that hyperbaric chambers are generally safe when used correctly, and that the fire was an anomaly. The defense argues that the Oxford Center never, ever knowingly put patients in danger. But this is pretty clearly able to be disputed, at least in my sphere of reality, because the Oxford Center was offering HBOT for unapproved conditions, which again raises serious ethical concerns, right? Even if they weren't putting patients at risk intentionally, they were running a facility that profited off of desperate families seeking alternative treatment. Informed consent is essential to any treatment, and without informed consent, families cannot make informed decisions about treatments. When parents are searching for answers, they'll try anything to help their kid. And I hope that Thomas's family was informed about the risks that hyperbaric oxygen therapy treatment does entail, because maybe they would not have made the decision. So in any type of treatment, informed consent is a critical part of the decision to move ahead with specific treatments. You need to know the risk versus benefit. Again, that's a conversation that needs to be ongoing, and understanding what the risks are of any treatment is essential. The bottom line is that medical professionals should not push risky treatments without solid evidence that the treatment will work for the specific condition. But the biggest question is, does this make someone a criminal? And that's the big debate in this case. Negligence is one thing, but proving that someone had actual intent to harm another person is a totally other separate can of worms. And that's tough to prove, and that's up to the jury to decide. Was this a tragic accident caused by negligence, or was that something more sinister, like a willful disregard for safety, that justifies these murder charges? At the end of the day, a little boy lost his life because of treatment that is not FDA approved for ADHD or sleep apnea, the two conditions that he had. With whether or not this ends in murder convictions, it's an important reminder that we need stronger regulations around alternative medicine. Just because something is marketed as safe or natural does not mean that it poses no risk. We'll be keeping an eye on this case as it heads to trial, but in the meantime, we want to hear from you guys. Thank you guys so much for listening. We're going to call it. The time is 22:09. That's 10:09 for all you non-military, non-medical folks. Farewell and good night. I'm out.
Bye.
Bye.